Now, on this program, I've been critical of the ABC's medical reporter, Dr Norman Swan, because he's been giving alternative policy advice to the government, much like what we've seen in that segment. Rather than reporting issues and analysing them, he's been used by the ABC as an alternative voice, an advocate for different policy directions. This is pretty irresponsible in a time of crisis, when we're trying for a cohesive national response. And there was some big news today when the ABC announced that Dr Swan is suffering symptoms, will be tested for the virus and is isolating at home. Let's hope he's okay. But we do need to keep interrogating his role. And I want to highlight a couple of tweets from Swan just over a week ago, 9 days to be precise. With infections just below 1,000 in Australia, he said they'd reach 1,700 by the following Monday, double that a couple of days later, and 7,000 to 8,000 by the weekend, that being last weekend. Later, when the tally topped 1,000, he said this was what was predicted if the government didn't, quote, do anything significant. He said the government had blocked borders but not done enough on social distancing, that it was heartbreaking and that it would have been so good to have been wrong. Well, the good news is that Swan was wrong, very wrong. The national tally today is just over 4,000, so we're running at least a week and a factor of at least minus 100% behind Swan's predictions. Our rate of infections is slowing. This could change. A major breakout could occur. No one ought to relax or get ahead of themselves. But all the evidence so far suggests the management of this pandemic, not just by the national government, but by the states and territories, our medicos and hospitals, and importantly through public behaviour. All indications are we're doing pretty well so far. Let's hope Swan is okay, but that his dire predictions continue to be wrong.